Welcome to Build Up California policy briefing on the May revision to the governor's proposed 2021-22 budget and investments in childcare facilities. My name is Ericka Erickson, and I serve as the director for Build Up California and policy and program officer at the Low Income Investment Fund for Early Care and Education. Created last year, Build Up California is a coalition dedicated to promote the equitable expansion, improvement, and sustainability of early learning facilities in our state. This year, we are working as members of the ECE coalition on a holistic budget request that includes many components of the child care system, including facilities, childcare facilities. That's our focus. And as part of this campaign and budget request, we have $350 million for childcare facilities. That is basically, we are requesting that the funds that were allocated for the early learning and care facilities infrastructure grant program in 2019, that's $263 million, would be restored this year together with additional funds for reopening grants for childcare providers. So as part of this campaign and as part of our series of events that we host to educate the public and the community about our work and about childcare facilities in general, we are hosting this policy briefing. And we are still facing an unprecedented crisis caused by global spread of the coronavirus, right? In California, due to the availability of vaccines and the respect of stay-at-home orders, we are moving towards the end of the pandemic and related restrictions, but it's still, we can still feel the consequence of the pandemic. So today, we will discuss the newly released May revision of the governor's budget. And we will take a look more specifically at the facilities components of the proposed budget, and we will discuss our recommendations. We are glad to have here some experts with us, and I would like to invite them to turn on the camera so we can introduce everybody. We have with us Kristin Schumacher, Senior Policy Analyst with the California Budget and Policy Center. We also have Angie Garling, Vice President for ECE for the Low Income Investment Fund, together with Olivia Barrow, Policy Manager at the Low Income Investment Fund. And then we also have Shaunte Brown. Shaunte Brown is the owner of HappyTime Child Care, and she's also a member of Child Care Providers United. We also have Pamm, Director of Strategic Funding and Partnerships with the YMCA of the East Bay. So it's my pleasure to be here with such great leaders for our field. And we will start a little bit of logistics. This is a webinar mode, of course. We will have the presenters. We will have approximately like 5 to 10 minutes for each presenter. Or panel member, starting with Kristin with an overview of the May revision. And then we will have Angie speaking about why is important investment in facilities, and especially as it compares the May revision with the master plan. And then we will have Olivia talking about the federal funds that we are very grateful for, and they are coming to our state and how we can best use them, or what are our options for facilities. Shaunte will speak about how important these kind of funds for facilities are for family childcare providers. And then Pamm will share her perspective as someone that has been working in childcare for many years, and now as at the YMCA as a Title V center, why these funds are important. So with no further ado, I would like to invite Kristin to share an overview of the May revision of the governor's budget. Kristin?
Good morning or afternoon, everyone. As mentioned, my name is Kristin Schumacher, And I'm with the California Budget and Policy Center. For those of you that aren't familiar, the Budget Center is a nonprofit in Sacramento that engages in fiscal and policy research with the goal of improving the lives of low and middle income Californians. My charge here today is to provide a brief and broad overview of the governor's revised spending plan for the 21-22 state fiscal year, which begins on July 1. As I'm sure many of you have heard by now, California's economic outlook is quite bright, especially compared to last year at this time. The administration put forth a revised $268 billion spending plan last week that includes $76 billion in additional state revenue. Despite the rosy fiscal forecast, the economic recovery is a long way off for many. The Budget Center projects that the state won't fully recover the jobs lost in the past year until mid-2023. This calls for targeting resources to those who have been disproportionately affected by the pandemic, particularly women, Black and Latinx Californians, and also immigrants in our state. One place to start is that $76 billion surplus that everyone is talking about. But it's really important to know what's behind this figure to understand how these dollars can go to Californians who are struggling to get by. So of that $76 billion, roughly half must be spent on funding for both K-12 schools and community colleges, and then also funding for reserves and paying down debt. These are requirements included in our state constitution and are based on voter-approved Prop 98 and Prop 2. So that revenue that's constitutionally obligated is illustrated with the green slices of the pie on the right, including the breakdown for both schools and reserves and debt. With that said, state leaders do have $38.1 billion in discretionary state resources that can be allocated across various programs and services, and that's that orange half of the donut right there. In addition to the state's discretionary resources, policymakers also have access to federal relief funds. The LIO noted that when that $38.1 billion in discretionary resources is combined with federal COVID relief funding, it's equal to about half of pre-pandemic general fund resources. This provides a tremendous level of resources that can help mitigate the effects of the COVID-19 pandemic and recession. The state also has the opportunity to distribute 3 rounds of relief dollars specifically for childcare. California's share across all 3 rounds is $5.1 billion. With that said, while the governor's revised spending plan focuses on distributing federal relief dollars to address all of the damaging effects of the COVID-19 pandemic, the May revision doesn't include much in the way of ongoing state funding for California's subsidized childcare and development system. So this chart illustrates the scope of federal relief dollars for California, displaying the additional funding from the CARES Act in April of 2020, the Supplemental Appropriations Act signed by President Trump in December, and the American Rescue Plan signed in March by President Biden. On the chart, the gray portion of the bars represent the annual CCDBG appropriation, the main federal funding source for childcare. The orange and yellow portions of the bars just display the additional relief dollars the state has received above this annual appropriation. So in just 1 year, the amount of federal funding, both annual and relief, increased by more than 500% in California, going from about $911 million to $5.3 billion. And again, this presents a really huge opportunity for state leaders to address the damaging effects of the pandemic for providers and families, to also lay a foundation for the future. But it also presents challenges for state leaders and for state government to efficiently and equitably distribute funding across the state. So the state received $964 million through the Supplemental Appropriations Act from December. In collaboration with labor partners, the administration distributed $404 million earlier this year. And the May revision provides a plan for the remaining dollars listed here on this slide. This includes $382 million in provider stipends, $206 million per child stipend for subsidized childcare and preschool providers, and then $177 million for one-time stipends to all licensed providers in the state. The spending plan also supports providers by providing $101 million for COVID-19 related closures and absences to make sure that providers aren't losing income when children are out, or if they have to shut their doors to quarantine, for example. The proposal also waives family fees for all families in our subsidized system, which is great news, It provides funding to expand licensed family childcare homes and provides additional consulting services for providers working with families dealing with stress and trauma. And again, this is all using the Supplemental Appropriations Act funding. While there is a pretty comprehensive plan for that bucket of funding, the revised spending plan does not provide complete details for the $3.8 billion in one-time American Rescue Plan dollars for childcare. For example, many of you may have seen or heard about the governor's announcement to provide 100,000 new childcare spaces. We've learned that that's about 63,000 for the alternative payment program, 42,000 for general childcare, and then about 1,300 spaces for migrant childcare. Complete details on the funding source and the term for these spots was not included in the budget summary, and then budget documents released last night do show that there will be about $293 million for voucher-based slots, $110 million for spaces and direct contract programs, both of which funded with ARP dollars. But this doesn't cover all 100,000 spaces. So full details on that large expansion in spaces in our subsidized system is still forthcoming. Budget hearings are going to begin this week. You'll want to stay tuned to hear more details there. And I'm sure that more administrative documents may be released soon too. I also want to note a big deal, especially for this webinar, is that the May revision provides $250 million in ARP dollars for childcare facilities. As Ericka mentioned, due to the pandemic, this year's state budget agreement rescinded funding for facilities that was part of last year's budget agreement. So this $250 million would restore nearly all of those funds, but it's important to note that this funding likely falls short of the investment needed in California for childcare facilities. Finally, the May revision also proposed $20 million in multi-year quality improvement program. So while the May revise outlines a partial plan for the use of federal relief dollars, the spending plan includes only a small amount of new state funding for the subsidized childcare system. The state identified in existing budget existing budget documents include $83 million Prop 64 childcare spaces, $6 million to update provider payment systems for providers, which is great news to move to direct deposit, and then $4.8 million one-time general fund to continue work on a childcare data system. There also may be some state funding that will be committed to that 100,000 childcare spaces, but again, those details aren't all available. Most importantly, the May revise doesn't provide any funding to update provider payment rates. Currently, rates are based on data from 2016 and are woefully inadequate to address the true cost of providing childcare in California, especially during a pandemic. So the last proposal I'll review is the governor's proposal to expand our state's existing transitional kindergarten program to all 4-year-olds over the next 4 years. Fully implemented, this is projected to cost $2.7 billion. One important note here is that the proposal would shift general fund dollars under the Prop 98 guarantee to pay for this expansion. And what this means is that by 24-25 fiscal year, there will be $2.7 billion fewer general fund dollars available for other services funded through the general fund. Finally, the May revision also includes $190 million in discretionary funds, so part of that $38 billion surplus, to provide grants to local education agencies for facilities. The first year grants will be limited to schools that don't offer TK in order to construct or retrofit facilities for new classrooms, and then the second year will be used for both TK and for schools to move from part day kinder to full day kinder programs as well. So I just want to conclude by noting that the state's strong fiscal outlook provides a real opportunity to lay a foundation for a more equitable state, for a more equitable California. And we can see that in some of the proposals included in the revised spending plan, such as $8 billion in another round of stimulus payments to low-income Californians, or $12 billion to address homelessness. There's also a proposal to expand Medi-Cal to undocumented older Californians, and then $7 billion to address the digital divide. And that's just to name a few. But I think it's really also important to acknowledge missed opportunities. For example, boosting childcare provider payment rates, or specifically providing more stimulus payments to immigrants who have been blocked from federal relief, just to name two. So the Budget Center is going to be releasing a piece in the next week or so that outlines some of these missed opportunities in the revised spending plan. You can sign up for our listserv if you want to get that via email or just tune into our website as well. Finally, I would encourage everyone to watch the budget hearings over the next few weeks as state leaders wrap up our budget for next fiscal year. We know that budgets are a reflection of our values and priorities, and this year's budget is a tremendous opportunity, again, to make a real change in Californians' lives. And at that, I'll hand it back to Ericka.
Thank you, Kristin. Thank you so much. Great overview. And just a piece of logistics, we are going to send the slides to everyone and all that registered to participate in this event. Together with the recording, we will have all the slides that will be used. All of them will be available to participants. And next, we will have Angie Garling, and Angie will share her perspective about the importance of investment in childcare facilities, especially at least $350 million as part of the budget. It's part of a holistic package that also should include the workforce and investments and other elements too. Angie?
Great, thank you, Ericka. And thank you to everybody supporting the webinar today and everyone who's participating. So it was really helpful to have Kristin give an overview, and we're going to dive more deeply into the facilities aspect. And I'm here really from the Low Income Investment Fund to talk a little bit more about why facilities are important from a more global view, and why $250 million is a fabulous start. And we're really glad that the money was almost completely restored, and then why there is a need for significantly more funding to ensure that we have healthy and safe facilities for all children and early childhood educators. So as we all know, childcare facilities provide a foundation for our society because having safe and adequate space to learn, socialize, and share prepares children for their future roles in our society. And we often talk about facilities as the third teacher. So, as well as supporting the children and providing critical play and learning spaces, as well as things like ventilation and shade so they're kept safe, they support the workforce as an important workplace benefit. And so I think that's also important to remember. And it's very clear and has been said many, many times, we don't have enough early care and education. We don't have enough family childcare. We don't have enough centers. The pandemic exacerbated our supply even more. And so we need infrastructure from the workforce perspective. We need those amazing early childhood educators, just like we need actual physical space. And LIIF and others, we believe very strongly that childcare and childcare facilities is infrastructure, and it is just as important to enable parents to go to school and to go to work as bridges and roads are. And so one of the things I wanted to say is some of the work that LIIF has been doing for decades, and just to give you a sense of what that looks like. So for example, just this last year in San Francisco, where we've done a lot of deep work, we have distributed about $15 million to childcare centers and family childcare. And one thing that is important is making sure that we have our diverse delivery system included in the facilities funding. So not just centers, but also home-based programs, ensuring that we're supporting family childcare programs. So what does that look like? So that means startup grants. So money to help fund teachers to get started, equipment, licensing costs, things to actually start up your program. So we have provided startup grants, renovation and repair. So, roofs or other kinds of things that programs need to help repair and improve the existing facility. Pre-development. So before you even build a building, it's helpful to look at whether it's feasible, to get some consultants on to look at a needs assessment. Is it serving the right area? Are we ensuring that the land or the space is adequate? So pre-development is another important component. And then the big part of what we do is capital new development. So how do we increase spaces through taking an existing space and doing tenant improvements or building from the ground up? And then for family childcare, there are three main products or grants that we provide. That is startup, expansion, and renovation and repair. And then more recently, due to the pandemic, we've been providing operational grants. And so that's just an example of the kind of array of programs that we believe are really important. And one of the things that I saw in the chat that I wanted to just mention that I think Olivia will pick up on is the fact that currently the intended area of funding or the source of funding for the $250 million is one-time ARP money, which there are several different types. And Olivia will talk a little bit more about this, but the actual childcare strand of that funding cannot be used for major renovation. It can only be used for, or major construction. It can only be used for minor modifications to facilities. And so that's a key question that we would like to find out today and in the future days through hearings and conversations with the governor about, what is that source of funding? What actually can be used for facilities? We've been doing some cost modeling with UC Berkeley on what it would actually cost. So $250 million is a great start. If we were to employ, look at the need for all children, assuming that some of them, a good portion of them would be in licensed care, that would be tens of billions of dollars. So we know that there is a very big need out there. And I will turn it over back to Ericka, who will introduce Olivia. Thank you.
Thank you, Angie. Another piece of logistics for everybody. We are going to have Q&A at the end. I think I didn't mention that. So Olivia will now share with us some information about the federal funds, the federal relief funds, and the different funds inside of the ARP too. So Olivia.
Thanks, Ericka, and hi, everyone. My name is Olivia Barrow. I'm the Federal Policy Manager at LIIF, the Low Income Investment Fund, where I have the pleasure of working with both Ericka and Angie. So I think you all know, because it is incredibly exciting, Congress has enacted an unprecedented $50 billion in the childcare sector to respond to the pandemic over the last year. And while none of these childcare specific resources are explicitly dedicated to either the construction or the expansion of childcare facilities, they can be used to improve health and safety in facilities and make some other quality improvements to the physical space. And separate from the childcare specific resources that Congress has enacted, there are other resources outside of the childcare sector that can be leveraged to expand supply and build new childcare facilities. So LIIF and our partners in the National Children's Facilities Network, we recently co-authored a brief with some partner organizations that outlines various strategies states can consider to use federal relief dollars to invest in physical childcare spaces and facilities. I believe that brief will be circulated as part of the follow-up materials, or perhaps Ericka could put it in the chat right now. And I do recommend taking a look at it for more in-depth recommendations around federal relief dollars. But I just wanted to briefly cover, while I have a couple minutes here, briefly cover two potential opportunities. So the first is the $24 billion in childcare stabilization grants, and the second is the $350 billion in state and local fiscal relief. So of the first of the stabilization grants that were enacted in the American Rescue Plan Act, which is being called ARPA, those funds are intended to do exactly as the name suggests, right? To stabilize the childcare sector. And so just last week, we actually saw ACF release guidance on the use of these stabilization funds. And in that guidance, they clarified that states may spend up to 10% of these stabilization funds for administrative, supply building, and technical assistance activities. So a couple allowable uses within that 10% cap could include things like technical assistance on business practices, developing a strategic plan for building supply in the future, or even conducting a community needs assessment, And also facility improvement grants would be an allowable use under that set aside. And then beyond that 10% set aside within the stabilization funds, states can also use these grants for facilities maintenance. And facilities maintenance would have to meet the definition of minor renovations under CCDBG. And so in the brief that I mentioned that LIIF and our partners recently released, in which I see Angie has just put in the chat, you can actually see the exact definition of what minor renovation refers to and what is allowable and what is excluded. But in the guidance that ACF shared, a couple of the allowable uses that they identified would be building or upgrading playground equipment, renovating bathrooms, or even removing non-load bearing walls to create additional space for social distancing. So that encompasses the child care stabilization grant dollars. I also wanted to now briefly touch on the $350 billion in coronavirus state and local fiscal recovery funds, which was also enacted in the American Rescue Plan. So the Treasury Department actually also released guidance last week on the use of these funds. And there are several activities that may be relevant to the childcare sector. So specifically, supporting small businesses and providing premium pay for essential workers, which of course includes childcare workers. And then the guidance on these state and local fiscal recovery funds also notes that funds can be used to expand early learning services and quality care. And that's specifically for the hardest hit communities and families. So we do believe that these state and local fiscal recovery funds can be used to invest in acquisition, construction, renovation of childcare facilities. The last thing I just want to mention very quickly before my time is up is that in addition to all of these resources we've already seen enacted, we do expect to see more coming down the pike from the federal government. So President Biden has proposed a $25 billion investment to upgrade childcare facilities, and that is proposed as part of his infrastructure package. And actually recently, Ways and Means Committee Chairman Richard Neal in the House of Representatives also proposed a $15 billion investment in childcare facilities. So Congress is still negotiating this infrastructure package. We probably won't see anything for a couple more months, but the fact that both the president and Democratic leadership in the House have proposed such strong investments in childcare facilities, I think is a really good starting point and certainly reflects a strong opportunity for us to strengthen our nation's childcare infrastructure. Back to you, Ericka.
Thank you, Olivia. Really important information. Another piece of logistics I want to share with everybody about not only this webinar or this event, but our work in general. We have a website, a new website, buildupcalifornia.org, where you can sign up to receive updates. Also, you can go to our advocacy page, and there you have our materials like fact sheets and letters, sign-on letters that you can join us in this campaign to get at least $350 million in investment for facilities. Again, this request is part of a holistic package as part of the EC Coalition, and we work with many other partners in the field to really make sure that our legislators understand the importance of the comprehensive investment we have to have in childcare to make it successful. This comprehensive investment includes the investments in family childcare. For many years, historically, family childcare, unfortunately, hasn't been receiving the attention and investments that are needed. So here with us, we have Shaunte Brown, owner of Happy Family Child Care, a member of Child Care Providers United, to share with us how important it would be if we had funds for facilities for family child care providers. So Shaunte?
Hi, thanks for having me. My name is Shaunte Brown, and I'm a family child care provider in San Diego. I'm also a member of my union, Child Care Providers United, or CCPU. Our union works to make childcare better for ourselves and also for the families that we serve. I've been doing this work for 24 years. I do it because I love children. I was a preschool teacher for a while, but I wanted to do more than just educate children. I wanted to nurture them and to love them as well. Home based care allows me to do just that. It allows me to help children feel safe and secure while their parents are at work. Family childcare is the first choice for many parents because it feels like home. The pandemic hit us, many of us, very, very hard. Thousands of California childcare providers had to shut down because of this pandemic. It happened to me too, just in November. I got COVID, and so did my assistant. We were blessed not to get too sick, and thank God none of our children were affected, but we were shut down for 21 days. We have been lucky to be able to pick back up and start running again. A lot of providers, they have not been so lucky. The pandemic's effect on childcare should be a wake up call to the systemic improvements to the childcare system, and that includes home based family childcare. Every family deserves access to quality, affordable childcare, and they deserve options. They deserve the right to choose a childcare that meets their family's personal needs and what's a good fit for their family. But with most of us living in childcare deserts where there aren't enough childcare slots to go around, there just aren't enough choices. If we want every child to get a good start and close the education achievement gap, the state needs to see the care that we provide is as deserving as the same upgrades and investments as other early child care education programs. Most family child care providers, we live month to month. We can't invest as much as we'd like in the areas of our homes that we use for our child care. I talked to a lot of providers about what they would do if they were able to receive funding to improve their facilities, and all of them had a wish list. A lot of providers would like more and better outdoor play equipment so the kids can safely exercise. They would like upgraded cabinets and shelving to make moving between activities easier and more efficient. We all had to make emergency changes to our facilities because of this pandemic. We had to put in hand washing stations. We had to purchase dividers, and we also had to do a lot of rearranging for social distancing. Our bills, they went up as well. All the cleaning and the hand washing, that meant higher water and electricity bills. And because we were facilitating older kids who were distance learning, a lot of providers, we had to pay for faster internet services as well. And in closing, we learned new ways to be safe while providing early education in the most loving environments as possible. Providers that I talked to, they would like investments to help pandemic improvements to be permanent. Things like cabinets for cleaning supplies and technology for older kids will go a long way toward making our childcares ready for the next emergency. Maybe the most important investment in our facilities is our untapped potential for growth. Many small providers would like to grow, but we cannot afford to do all the modifications needed for quality to improve for our large license. Some of us are barely covering expenses, and we can't all make the upgrades without our outside investments. There's so much opportunity for expanded childcare availability if we just help the providers who wanted to expand. I'm glad we're having this conversation today. It's time we recognize home based childcare as an essential part of California's early childhood strategy. To do that, we need to invest in the facilities that provide home based family childcare. Thank you.
Thank you, Shaunte. Really good perspective that you share with us. Next, we are going to have Pamm Shawn. Pamm is the Director of Strategic Funding and Partnerships at the YMCA of the East Bay, and she's going to share her perspective on the importance of these investments for Title V centers. So Pamm.
All right, thank you. This is so exciting. And ditto to everything Shaunte said. And since both my kids were in family childcare, I have a very strong affinity for those programs as well. You sharing my PowerPoint or am I? Okay, there we go. I'm going to walk you through a couple of our facilities and some of the things that we've been working on. The YMCA, next slide, please. The YMCA serves about 1,200 low-income children and families in 21 locations in 4 counties in the East Bay and Yolo and Sacramento counties. We have 17 directly operated centers and 4 partner sites. We have CSCP, CCTR, for those, most of you I think know the acronyms, but state preschool, general child care, migrant, state migrant, Head Start, early Head Start, and early Head Start childcare partnerships. And we blend and braid and layer all of our funding. Next slide. The big question about facilities when you're looking at center-based care, and particularly large centers, is to make sure a center is large enough to be cost effective and have the staffing that you need. Do we remodel? Do we renew? Do we renovate? Do we find something new altogether? And when we've taken federal money in the past, that's one of the bottom lines that they want to know. I'll talk a little bit about that in a minute, but I'm assuming there's strings attached when we have any kind of government money to do this kind of work. The funding, it's not just about getting the money, especially government money, because there's different requirements for different funding sources. So if we take state money, federal money, grant money, can you go back, please? Can you go to the previous? Thank you. You also require expertise. There's permits that take forever. There's bid processes, monitoring the work and timelines and the funding, because the funding goes really quickly when you make any kind of changes from what you plan to do. Again, renovate or replace. Do you replace a portable building that's falling apart, or do you renovate it? Next slide. You need to have a justification for the funding, and it sounds like it's going to be really important with this money, with these strings attached, that you can justify that we're looking at why we need the money. So if you're expanding services, that's one thing. But if this TK bill passes and they're expanding TK, we may be looking at a lot of providers switching from preschool to infant toddler or serving younger kids. Those buildings look different. Those classrooms look different. The furniture looks different. The equipment looks different. The bathrooms look different. So it's going to be interesting to see how this plays out at the state level. If there are licensing violations due to health and safety concerns, if there's findings from a CMR or a Head Start review, if you're looking at the age or condition of a facility, those are all justifiable reasons for applying for funding. Next. This is our East Lake Early Learning Center. It's an old YMCA building that was with a big gym in East Oakland. Next slide. We obviously gutted the building from head to toe. It was an old building, and it required everything from a new roof to new classrooms to new walls to new plumbing to new everything. Next slide. Next slide. This is what it looks like today. It was started out as a $5 million project that wound up costing over $6 million by the time we finished. It took about 2 years to renovate, do everything we needed to do, and get it licensed, which was a lot longer than we had expected and hoped for. And this was paid mostly out of federal money. We had some state money and a lot of YMCA money pre-pandemic, when there was YMCA money to be had. Next slide. Also, the outdoor playgrounds were done as well. Next slide. So the federal government requires a 1303 application is how they refer to it, with a pre-award checklist that spells out all the requirements. The federal government requires Davis-Bacon to be used. That's prevailing wages, which is making any kind of facilities project more expensive. I don't know that if the money comes from the state that they will require Davis-Bacon, but oftentimes they do. And require all sorts of approvals. More federal requirements can be found on the ECLEC website. And for those of you who are not familiar with ECLEC, ECLKC, there's a lot of resources there for childcare. Next. We've also gutted portables. Go ahead, I'm going to zip through the slides quickly. You could see it was mostly an outdoor and indoor, kind of gutted the inside as well. Keep going, keep going. We're working on Cherryland right now. One of the things we found with this site is that in order to get the permit, which took over a year to get this permit from Alameda County, and part of it was due to the pandemic, part of it was just due to because every time we'd submit the plans, they'd want something else. And one of the things they wanted was for us to trench to make sure that it wasn't on an earthquake fault. And if you're doing anything in many areas of California, this is going to be an issue. Next. We're planning ahead now. We have 2 other sites, one in Richmond, one in Oakland, that are ready to go. We have plans drawn for both of them and a plan to put kids in both of them. And hopefully some of this money will be available to do some of these things. So thanks. And I will turn it back to Ericka.
Thank you, Pam. And I'm sorry for the presenter mode. I couldn't do it. I couldn't revert to full screen. But I think that we had such great presentations and perspectives share here. And we have a few minutes for Q&A. I would like to invite all the speakers to be on the screen again, so we can have short discussion. So I saw in the Q&A question about if these funds would be grants and how they would be distributed. Anyone would like to share the answer to it?
So I can try to respond. I think the short answer is this is intended to be grants, not loans. And one of the things we also realize is that the money is, the 250 million will not be enough to reach all the goals that we would like to reach. So one of the things that organizations like community development financial institutions can do is leverage other pots of funding. So, for example, on a particular construction project, you might have, as Pam was saying earlier, 3 or 4 different sources of funding, only one of which might be this, state facilities grant program. And so it would be important to have expert technical assistance groups to help package financing to make sure that you can actually complete a project. And so sometimes you would package grants alongside loans. So some of it may depend on the specific details of how they set the program guidelines. Like, will it be $1 million grant maximum, or will it be a $2 million grant maximum, or will it be more or less? Sometimes that may make or break whether or not a program gets fully funded. But short answer is intended to be grants.
Mm-hmm. And Pam, what's your perspective in terms of how these grants should be distributed, in terms of perhaps the criteria? What would make it easier for you and regarding the accessibility of these grants?
So, I think, Shaunte made it real clear that family child care needs to be able to do this. And I think there needs to be technical assistance for programs that don't have the expertise, especially smaller programs that may not have ever applied for any kind of facilities money before. I think it needs to be easy, but there also needs to be strings attached, because it's really easy to get lost in what happens when you start getting involved in doing facilities work. Mm-hmm. And there needs to be somebody who knows something about working with contractors, because they're an interesting group these days. Mm-hmm. And they've got lots of work since the pandemic, because people are doing their houses, and it's really hard to find good people for reasonably priced.
And the cost is increasing, right?
The cost is increasing. We started out with a plan a year ago for our center in Hayward and in the Cherryland section, which is a real childcare desert out there. And it was started out around $4.5 million, and now it's looking like it's closer to $6 million to do that also.
Yeah. Shaunte, any insights about how this grant should be distributed?
Yes, I saw the question, and the one thing that I would like to say is make it available for all child care providers. And it's one fund, so you separate the fund. You have part of the fund for your center-based facilities, and then you have another part of the fund for family childcare facilities.
Mhm. Yeah. Thank you. So is there any other question that's like anyone saw in the Q&A or chat that you'd like to address before we close?
Yeah, I saw two questions. One was about the timing and one was about, will private programs as well as state subsidized programs be able to participate? And so the first thing on the timing is that the budget hasn't passed yet. So the important thing is that we have to make sure that the budget passes and it has the funding that we, the kind of budget that we would like to see. And then the timing, will probably come out over the next year if the budget is successful. And then, currently, I don't believe that in the Facilities Infrastructure Fund, it has allowances for private programs. But I do, but maybe Kristin can take that question, but I know that ARP funds do allow for private programs. So I don't believe that's been completely settled yet.
Yeah. Well, I remember the language that is in that code for the program, it allows, but maybe we will see how that's the time. So that's a good segue for our closing. I want to invite everyone to be involved in the public hearing process. We have a month to go until June 15th when the government needs to approve the budget. There will be many hearings and there are many opportunities to voice your opinion, to learn about the process, including influence how the language will be shaped regarding this program, the infrastructure grant program, right? Who is going to receive and et cetera. So I will invite everybody to join us. Please visit our website at buildupcalifornia.org. Click on advocacy, sign up for updates, join our campaign with the sign-on letter that we have, the initial one. And then we will keep you updated about all the hearings. We'll make it easier for you to speak. So if you're an advocate or a provider, please join us. And if you are representing a government entity or if you work with legislators, please count on us to be your resource for information regarding facilities. With that, I would like to close by thanking our speakers. Thank you so much, Shaunte, Olivia, Angie, Pamm, and Kristin. I think it was a very informative event and hope to have you with us in future events. And again, if you would like to know more about our work, please visit our website, buildupcalifornia.org. Follow us on social media. Use our hashtag BuildUpCalifornia. Build Child Care for California is our hashtag for this campaign. So thank you so much. And thanks for joining us today. And we hope to see you in future events. Thank you.